Hello, it's me again, and as promised, I'm here to take you on a journey on how to manage your bowel. Today, I'll be talking on why your gut health matters, the truth about various bowel conditions. There are several bowel conditions which I have experienced in practice. They include hemorrhoids, diverticular disease, IBD, and colonic polyps, not to forget bowel cancer, which is a life-threatening condition, which I will talk in more details as the day goes by. Last time, we talked about the various signs and symptoms which you need to look out for. In today's episode, I'll be talking about these disease conditions and their unique signs and symptoms. So there could be some signs and symptoms which will be repeated in most of these conditions. So you need to look out for each of the signs and symptoms. If you do experience any of them, then it could be that your bowel wants you to seek the input of your doctor. For today, the first conditions I'll be talking about is pile, otherwise called hemorrhoids. Hemorrhoid is when the blood vessel in your bowel, especially in the lower part of your bowel, is protruded, and there are degrees of hemorrhoids. The signs and symptoms of hemorrhoids includes bleeding from the back passage, itching of the back passage, pain in your back passage, difficulty in passing stool, especially when you're straining. In my further discussion, I will be discussing on how to better manage your bowel. Then I will be able to talk about what you need to do to avoid hemorrhoids. Number two condition, bowel condition, which I want to talk about is called IBD. IBD has types, which includes ulcerative colitis and Crohn's disease. If your father, your mother, or anybody in your family lineage has IBD, the chances that you will have IBD is very high. And what is IBD? IBD is when the surface of your large bowel is really inflamed, the redness of the surface of your large bowel. And this could be evidenced with diarrhea, constipation, abdominal pain, anemia, and passing of blood in your stool. So if you're having any of these signs and symptoms, then you may need to speak to your doctor to see if they could send you a colonoscopic procedure to identify if you do have any of the symptoms, especially if your diarrhea has exceeded 4 weeks. Number three, health bowel condition is diverticular disease. I want you to imagine a road with a pothole inside it. Diverticular disease is when there are pockets or pouches in your large bowel. And because of this pocket in your large bowel, sometimes when stools travel along your large bowel, this stool sits in those pockets. With the pockets in your large bowel, you could experience diarrhea, constipation, abdominal pain, especially when this pocket becomes inflamed or becomes red. You could also experience bleeding from your back passage because with further deterioration of this pocket or these pouches, then you could see blood in your stool. Another health bowel condition which is not identified until we put in a camera up your back passage is called colonic polyps. Colonic polyps are when there are seed-like growth off the surface of your large bowel. These polyps are like grains of seeds. They grow off the large bowel. And if they are left there, they could turn into something cancerous. So if you are sent in for a routine colonoscopy procedure, that is when these polyps are identified. So this forms the basis for which we do what we call a bowel cancer screening program. Bowel cancer screening program will be discussed in my other subsequent discussions. Are you experiencing any of the signs and symptoms over a period of time? I would advise you to seek the input of a doctor to see if you really need to be sent for an investigation to help identify whether you fall into any of these bowel conditions. As always, I will be here to guide you by the hands on what you need to do with regards to your bowel health. I will not just be talking about your bowel health, I'll be talking about your stomach, your food pipe, and every other part of your body. So until I see you next time, I want to find out, are you having any of these bowel problems or any of those symptoms highlighted? I want you to leave a comment in the comment section and let's have a conversation. If you have any question, please do not fail to ask the questions in the comment section. And also don't forget to subscribe and like this video, as I'll be bringing more topics your way as the day goes by. Watch out for the signs and symptoms of your bowel. Until I see you next time, do take care of yourself, especially your gut health. Bye bye.